much for coming to Kamugisha in Bosco and the work with Global Emergency Care Cooperative in Uganda, one of the hospitals in the rural area. And I did this research because in our emergency department we get cases of domestic violence every time. And we just saw it at one of the parishes within the municipality, which is one of the districts in Uganda. And we have nothing to discuss. I did this with my supervisor at the university with the help of Dr. Mark, who is sitting right there, and Dr. Brad. Thank you so much. And we have seen that violence is common against men and women, though men tend to be inferior in reporting domestic violence. And we have seen in Uganda it must be increasing, and most of these include rape, sexual assault, verbal abuse, sexual humiliation, sexual enslavement, forced incest, and forced rape. And in Uganda, some measures like advocacy programs, newspapers launching and disseminating the status on domestic violence, press conferences, and public dialogue, some of the measures governments are using to at least make sure everyone understands domestic violence. And most of these people experience violence may need to at least get emergency care. And the purpose of this study was to assess factors contributing to violence in a rural district in Uganda, which has a population of around 240 people per square kilometer. And we enrolled 54 married men and women and interviewed from December to March. Policemen were also asked to fill a questionnaire and use purposive sampling to select the policemen, because most of them handle these cases at police stations. And we use descriptive statistics to analyze our data. And we have some of the photos of patients who are victims of domestic violence. For example, that was a woman who was fighting with the husband, and he got pang and cut her. And actually her lower jaw was off one side. So like we said, these patients need to have emergency care, which we actually provided, and we later referred this person for specialized care. Then we have this woman who was disfigured by the husband, who had actually gone away for like 3 years. And when he returned home, he found this woman had built a good house with iron sheets, and that is someone who had left a grass-thatched house. So he said, "Where have you been getting the money?" So he tried to cut the woman, actually wanted to kill. So when he cut that first arm, then the lady was protecting herself, then he cut the other hand, then he tried to cut the whole arm, and this lady ran away. So she ended up in the neighborhood, and they helped her bring her to the hospital, and the husband had to run away. Then that is one of the man who came home drunk, and as he was provoking the woman to give food, because this woman had not put the food on the table. So the man wanted the food direct on the table and said, no, you have to go and get the food from the kitchen. And this man hit the lady seriously, though we didn't get the pictures of the lady. And later this lady came with a panga and cut the husband. And this man was hiding when he came to the hospital. I was riding a motorcycle and I fell down. But later when the wife came, she's the one who reported. So results, forms, we found that verbal abuse, near sex, forced labor, physical beatings, and deprivation of food and shelter are the most forms within Rakalengo. And common factors contributing to this were poverty, infidelity, late arriving home, alcohol abuse, and psychological imbalances. Then for women, it resulted in physical disabilities, divorce, homelessness, and poverty. And we had poverty, we had 15 cases, which is 27.8%. Infidelity, 12 is 22%. Late coming home, 10. Alcohol abuse, 8. Cultural beliefs, 5. Psychological disorders, 4. And violence is common in the families within this parish and mostly destabilizes the homes. And further research is actually needed to see if this is happening in different areas, because this was just from one parish. Then our government still needs to sensitize and provide some of the resources to at least reduce on these causes. And health workers who handle these cases also need to at least screen them for violence, and appropriate counseling services and referral to appropriate facilities is also needed. And this research, like I said, was done with the help of Dr. Francis Kazibwe, Dr. Mark, Dr. Brad, Chibad Hospital, the participants, and Bishop Stewart University, then Rob Emergence, and those are the references. Thank you so much.
Does anyone have any questions?
Thank you, John Bosco. Those images were very, very touching. So I'd like to just find out about the care that you gave them. Was it only physical care, or did you actually give them some counseling to try to avoid a repetition of similar incidents?
Thank you so much. Most of them, when they come, usually they have psychological problems, so we have to call in the counselors. So it is a teamwork working on these people. So counselors come and talk to them. We also have to do physical management, and like I said, referral also. Thank you.
I'm Gavin from Rwanda. Just like to share a little bit. In Rwanda also we had something similar to this. Not the genocide, yeah? We are trying to be nice nowadays. So there was this domestic violence, and once they conducted some research, they found that, like in our society, I guess it would be an African society, divorces are not allowed. So these people get together and they are not really, divorces are not common. Nowadays, in Rwanda, what they are trying to do is, they are trying to legalize marriages, and they are trying to ease divorce. So that in Rwanda, from that time, from the implementation of this policy, like for the last 3 years, divorces have gone up and domestic violence has come down. Have you thought of that in Uganda?
Thank you so much. Most of the families in Uganda have not regularized their marriages. And some of these problems will be resulting from factors like someone didn't pay the dowry, someone is maybe doing this and this, but in Uganda we haven't actually thought about regularizing the marriages and reducing the cases of violence. Thank you so much.
Okay, any other questions?
Well, why did you want to do this study?
I did this study because cases of violence were increasingly coming to our emergency room. So we wanted to see what could be happening in these areas.
And what will you do with it?
So we have disseminated this research and we have actually involved the police to at least arrest some of these people, but the challenge is after an arrest, the wife has to take the food to the cells every time, and sometimes they feel it is disgusting and this man has to be released and comes back home. The violence starts again. So it is a challenge after involving the police, the probation officers, and
So you're going to do a follow-up study.
yeah, we have to do a follow-up study and see how we can involve other authorities to at least make sure everyone knows violence and how to at least report and get help. Yeah.
Phyllis, is domestic violence illegal as per government law in Uganda?
Yeah, they have drafted the law against violence, though it is not so active.
Right.
Because some people fear to report cases of violence. Like the ladies, like in the culture, they say if you report that the husband beat you, then that would maybe reduce the respect you have in the family. And most of them could be people who have money. Yeah. Thank you so much.